Hi, I'm Mel. I'm one of our dietitians here at Active Health Clinic, and today I want to walk you through what our dietetic service actually looks like. So at Active Health Clinic, we have a special interest in supporting people with invisible illnesses, which includes conditions such as MCAS, POTS, orthostatic intolerance, dysautonomia, hypermobile spectrum disorder, EDS, MCAS, chronic pain, fibromyalgia, long COVID, etc., etc. And really our goal is to help those living with invisible illnesses understand what's happening within their bodies so that they can feel more in control of their health rather than their symptoms being in control of them. So when I book in an appointment with a dietitian at Active Health Clinic, first we will start with an initial consultation. This is where we will do a really thorough assessment to understand where you're currently at, where you have been, your history with your health, your journey along the way and what that's looked like, your goals and what you want to prioritize in session and therefore where you want to go. And then from there we create a very personalized and individualized pathway to help us reach those goals, because no two people are the same and individualized care is an incredible priority of ours. It's important to note that our assessment is quite thorough because we really understand that people can live with multiple overlapping and interconnecting health conditions, especially those with invisible illnesses. So we like to look at that bigger picture. So for example, we might screen for gut issues alongside chronic fatigue, food reactions, possible MCAS, possible IBS, appetite changes and nervous system dysregulation. So we may ask you some questions that you may not expect from a dietitian. In our future sessions, we have an education first approach because a big part of our role as dietitians in general, but especially working with invisible illnesses, is helping you understand how your nutrition interacts with your symptoms and vice versa, as well as how your symptoms and triggers and your energy levels are all interconnected, how things like blood sugar or hydration, gut health, bowel habits, possible inflammation may be connected to what you're experiencing. And so we try our best to educate and to help you understand this so that we can better implement strategies and the tangible things that are actually going to help and support you. So alongside that individualized education that helps connect the dots between your conditions, your symptoms, and your nutrition, we focus on tangible, individualized, and realistic strategies that help you work towards your goals. One thing I also like to mention is that we do tend to focus on, and again, everyone is different, but we tend to focus on how you're able to access food consistently before we recommend exactly what we may be wanting to add to your diet. And this is because living with invisible illnesses can come with many barriers to accessing food consistently for many people. Not everyone, so again, we do this as appropriate, but we find that this is what sets us apart from other dietetic care because we really understand that if we are just providing education of this is what the research recommends, these are the types of foods that you should be having, make those changes and see you later, that we're less likely to see you actually be able to work towards those goals in the long term because it just doesn't feel realistic and sustainable. So we really do try to help provide you with the right tools and strategies to make sure that you're able to have food consistently and find that stable baseline to then bring in more nutritional density and variety as tailored to you. Furthermore, and depending on your needs, we might also work on building nutrition that supports stable energy and reduces crashes. We might help and talk through identifying any food triggers or sensitivities, supporting gastrointestinal symptoms like nausea, reflux, constipation, diarrhea, etc. And we may also help improve or modify hydration patterns, electrolyte balance, salt intake for those with POTS or OI/dysautonomia, and also just really, again, that focus on meeting your nutritional needs in a way that feels manageable and realistic to support you best long term. So after that initial session, that is the assessment, we will map out what a pathway of our sessions may look like. We generally recommend a series of sessions, not just one-off appointments, so that we can build off of sessions, work through a really structured and tailored plan that works for you, and just adjust things based on how your life and your body responds, and also just making sure that you feel supported and well looked after, as opposed to waiting months in between appointments to get in. But obviously we can tailor the frequency of appointments to best suit your needs. It's important to mention that our sessions and the process is all about collaboration. You know your body best, but we also can understand that it is hard to look at yourself from that bird's eye view to understand what's going on. So we're here to guide you and support you, and helping make sense and put together the trends and the patterns within your health, so that you can move forward and implement these strategies in a more sustainable and realistic way. At the end of the day, our goal is really simple. It's to help make invisible illnesses visible, to help you understand your body better, and to support you in taking back control of your health and your nutrition. If you have any questions, please feel free to reach out to the team. We're always here to help and hopefully support you along your journey.